First at 4, we ditch the snow, but not the rain. Find out how long we're going to have to wait to dry out and warm up. Karen?
All right, thank you, Ben. Also, first at 4, critical capacity. A major hospital shows us what the new COVID surge is doing to local health care. Paula.
A state rep explains why he refuses to get a COVID vaccine.
I just think that it goes against the whole concept of being a free country.
And why some others say this is dangerous thinking, especially from someone in state government.
Also, former police officer Derek Chauvin answers one of the biggest questions hanging over his trial in George Floyd's death. His answer and what comes next. This is First at 4.
Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News First at 4 starts now.
Good afternoon, everybody. I'm Karen Drew. First at 4, the new COVID surge in Michigan is pushing local hospitals to the breaking point. Plus, one drug maker is talking about annual COVID shots. Right now, the state of Michigan reporting 6,300 new cases in the past 24 hours. That's 2,500 less than 2 days ago. The 7-day positivity rate stands at 15%. Plus, we've seen an additional 112 deaths, most of those coming from a review of records. New today, Pfizer's CEO says it is likely we will need a booster dose of the COVID-19 vaccine within 12 months of our second shots. Plus, he says we may need to get vaccinated every year. The Johnson & Johnson vaccine remains on pause this afternoon after a CDC panel decided it needs more information on rare blood clots. That panel won't meet again for at least a week. Closer to home, Beaumont hospitals are at a critical capacity in this third surge. It says right now there are 800 COVID patients in its 8 hospitals. That is higher than the second surge in the fall. They say this time around it is a younger age group with the average in the low 50s. Its hospitals are at 90 to 95% capacity. They're postponing non-urgent surgeries and will set up triage tents to handle the stress of emergency rooms. Doctors say vaccines will work, but not quick enough to get the surge under control now.
If you also look back at our prior surges, what was the difference? The difference in the first surge that we experienced was that there were restrictions in the community to limit gathering sizes and limit indoor activities that we know are very effective ways to transmit coronavirus. I do think that we have to have some level of commitment to restrict some of those activities in the community.
So coming up at 5, Rob Maloney continues our coverage with more on why doctors are calling the surge a runaway train and what can be done to stop it. But don't forget, the state's vaccination efforts continue with Pfizer and Moderna. We are tracking vaccine info online, helping you get your shots, including a live blog for your questions. Just go to the homepage at clickondetroit.com. A 7-year-old girl is shot on Detroit's west side, and police say her father pulled the trigger. Investigators say the girl's mother and father were fighting at a home on Apolline near Chicago Boulevard and Myers. They say as the mother tried to leave, the man fired shots at her car, hitting his daughter. The girl is stable at the hospital, expected to be okay. The man barricaded himself in a home for hours overnight and was taken into custody. Well, depending on where you live, you might have seen snow, rain, maybe some sunshine today. It's definitely a chilly mix of weather. So where do things stand right now? Ben Bailey has a quick look at our first forecast.
Yeah, Karen, we're almost done with the rain showers, at least this round that we're watching right now on Storm Tracker 4. A lot of this is on the east side. Drier conditions in the west and north zone, although it's possible we could be seeing more of these showers develop as we get through the evening hours. Some of the models suggesting that, but we should be dry by midnight hour, even if that stuff does redevelop in the next few hours going into the evening. Here's a look at your weekend. Never too early to start talking about that. 59 on Saturday, 61 on Sunday, but we do have at least sprinkle chances both weekend days. So we'll talk about which day is more likely and when we can finally get some of these warmer temperatures back here that we enjoyed last week. All that coming up in just a few minutes. Karen?
Thank you, Ben. Former Minnesota police officer has made her first court appearance in the shooting death of Daunte Wright. Kim Potter appeared briefly on Zoom for the largely procedural court hearing. She was her attorney's office as she's free on bond, facing a charge of second-degree manslaughter. The former police chief of Brooklyn Center has said Potter fired her gun at Wright Sunday when she thought she was reaching for her taser. outrage over the shooting has led to 4 nights of protests. Potter will be back in court on May 17th. Both sides have rested their cases in the murder trial of Derek Chauvin without the former Minneapolis police officer taking a stand. As he is allowed to do, the officer invoked his Fifth Amendment right to not testify in his own defense. Kimberly Gill with the latest. And Kim, the case now moves to closing arguments.
That's right, Karen. Good afternoon. Chauvin told the court he understood that he had the option to testify, but has chosen not to. His defense team has spent the last 2 days presenting their case, arguing Floyd died of underlying health problems and drug use and not police restraint. Before the defense rested, the jury was brought back to hear rebuttal testimony from pulmonologist Dr. Martin Tobin. The prosecution requested to present new evidence on carbon monoxide levels found in George Floyd's blood. The state was trying to debunk yesterday's testimony from a defense expert witness that carbon monoxide poisoning could be one of the contributing factors in Floyd's death. Prosecutors told the court they just became aware of the results Wednesday and should be allowed to include them. But the judge ruled the tests should have been known to the state in advance.
Late disclosure has prejudiced the defense. It's not going to be allowed. So Dr. Tobin will not be allowed to testify as to those lab results. If there's anything he wished to add about carbon monoxide as far as environmental factors, but if he even hints that there are test results that the jury has not heard about, it's going to be a mistrial. Pure and simple. This late disclosure is not the way we should be operating here.
Dr. Tobin disagreed with the defense's carbon monoxide theory, but without mentioning that new evidence. So closing arguments are expected Monday. After that, Derek Chauvin's fate will be in the hands of the jury. Karen, back to you.
All right. Thank you, Kim. Michigan is in the middle of a massive vaccination effort, but not everyone is getting on board. One Michigan state representative is going public about why he is refusing a COVID vaccine. He spoke to our Paula Tutman, who's hearing from experts who have concerns about the potential impact on public policy. Paula?
Hey, Karen. Yeah, you know what? People have various opinions about a lot of things, and sometimes those opinions are grounded in misinformation, but it's their opinion. But when misinformation drives policy and law, it bears further scrutiny. He's Steve Cara, a 32-year-old Republican state rep of the 59th District of Southwest Michigan. And in terms of getting or not getting a COVID vaccine,
I'd say refusal, but I respect other people's choice to get it, though.
he cites a multitude of reasons.
It's in its emergency use only authorization. Just the amount of pressure that government is putting and imposing. We're even talking about potential vaccine passports.
To be clear, the Biden administration has come out squarely and unequivocally against even the notion of vaccine passports for proof of inoculation, and the vaccines currently available have not been mandated by the government.
I think there's other remedies, things like making sure that I get my vitamin D. Hydroxychloroquine is an option if people want to go with that.
Fact check. Hydroxychloroquine was studied as a prophylactic way to stop the virus infection. It was shown not to be effective at all. But one of his biggest complaints is funding. He voted no on HB 4019 in February, a bill that would disperse federal COVID funding for vaccine distribution, testing, food assistance, and other areas. He states because the allocation of funding for contact tracing and surveillance without a warrant is intrusive and inappropriate governance.
Perhaps a private sector company could say, hey, we're going to start the research and development for a vaccine, and they sell it to people on the market. Somebody who wants to pay $50, $60, $70, go to the doctor, pay their copay, and get COVID-19 and pay $50 for it in the private sector, and insurance companies, all in a private sector fashion.
So you're saying that it would be okay for low-income people to try to figure out how to get $50 or $60 to get a vaccine, as opposed to the government saying, hey, this is free, this could save your life?
Well, how many of those people also have a cell phone? Maybe you not have your cell phone for a month. I mean, if it's life or death, I think people can find $50 or $60 to go buy a vaccine off the market.
Dr. Jason Wasserman is a bioethics expert from Oakland University. He watched the entire unedited interview.
I think what's really dangerous is that this kind of notion is sweeping through the country, especially in different sectors. Again, it's more startling coming from an elected official, because their obligation is to create public policy on the basis of the weight of the evidence. This is a shocking kind of almost cult-like mentality. And that's what I'm more concerned about, is that no matter how much evidence is brought to bear, there seem to be people who are committed to unsupported views that are damaging public health.
So while State Rep Kara is a state rep now, he has made it clear that he will be challenging the 6th District U.S. Congressperson Fred Upton in the midterms in 2022, Karen.
All right. Thank you, Paula. Still ahead, first at 4, the calendar says April 15th, but don't panic if you haven't filed your taxes. We have an update on the deadline, including information for anyone who pays taxes to the city of Detroit. Also, why do these frogs need help crossing the road? 2 big reasons, and here's one hint. Love is in the air. Speaking of love, a social media giant is working on a new kind of speed dating. We're going to talk about what could make this future app a little different. Stick around for trending stories.